Good morning, students. In the previous class, we have discussed about all the important quantitative designs, namely the true experimental designs, quasi-experimental designs, pre-experimental designs, and the non-experimental designs. Now, this class, we are planning to discuss about the next important approach in research design, that is the qualitative research designs. Now, these designs are comparatively a newer designs. In olden days, we were having only quantitative designs. We are not aware about, or we were not doing any of the qualitative research studies. Only for the past 20 years, we are concentrating much on the newer form of design called as the qualitative design and qualitative studies. Here, as the name indicates, we are focusing mainly on the quality, non-quantifiable data. So here we are collecting informations or the verbatims from patients. So the verbal data, descriptive data, narrative data are collected from subjects and that are analyzed using a specific statistical method that is entirely different from quantitative analysis. This is called as a thematic analysis. The thematic analysis can be done manually, and even this for specific type of computerized thematic analysis also is possible. And we'll do the thematic analysis and we interpret data. So all the aspect of methodology is entirely different for qualitative research studies. There are so many qualitative research designs are there. The main qualitative research designs include ethnography, phenomenology, grounded theory, historical research, case studies, narrative analysis, qualitative outcome analysis, critical theory, feminist research, participatory action research, and descriptive qualitative studies. The list is endless. That is why the final group, descriptive qualitative study, include all the studies which other than this and the studies which will come in future also included under the descriptive qualitative studies. So the differences between each category is distinct and each one having its own characteristics. We'll just see one by one. It can be asked as a short note, very rarely as an essay question for the university exam. And we got even once it was asked as an essay question also, but most of the time for UG students this will be asked as a short note. But short note can be asked from one of the qualitative studies. For example, a short note about the grounded theory can be asked. I will see one by one. Ethnography is the description and interpretation of cultural behavior of a group of people is done. That is the ethnographic studies. So, a specific culture and how people behave in that particular culture. The description of that and the why, the interpretation of that is done in the ethnographic studies. So any study that is done in the tribal groups mainly the sociological studies and behavioral studies that are grouped under ethnography. Remember, data is not quantitative data, but we will collect the data by observing their cultural behaviors. For example, the different forms of tribal dances, or their customs, or their eating pattern, or their marriage system existing there. We'll observe, or we'll do an interview of few persons. For example, what we'll call as the leader, tribal leader, or tribal women, etc., or the people who are becoming sick among the, and not only tribes but even any other culture people, where we study the cultural background. Can be a Brahmins also, can be any other Christians also. We basically study the cultural behavior of a group of people, and then we use even the record observations. We'll read records, collect different forms of records that may be kept in the panchayat, maybe in the hospital, maybe in the library, etc. Perusal of records. Then material evidences like the weapons used by them, or what we call it, the stones, or the pictures in the caves, etc. So these type of materials will be collected, and the description of that is done, and the interpretation of that cultural behavior is done in the ethnographic studies. So this, I'll repeat once more, ethnography means description and interpretation of cultural behavior of a group of people. The researcher will use different methods like observations, interviewing, perusal of records, and material evidences for data collection. That is ethnography, one form of qualitative study. Now, another form of qualitative study which is commonly used is phenomenology. And we have done a lot of phenomenological studies in our college also by the PG students, because that is one of the commonest form of study that is used by the nursing students and even by the other students of other discipline. The phenomenology reports in-depth experience of a person related to a phenomenon. This is, for example, the quality of pain of a patient who receives palliative care. Or we can collect, we have done a few studies like the experience of the people at the time of wearing the ventilator, or those who have received organ transplantation. A specific group of people, what is their in-depth experience related to that phenomenon? That is what is studied in phenomenological studies. This is mainly done through in-depth conversation. That is a method of data collection. So the researcher will conduct in-depth interview. That's mostly a structured interview. You prepare the questions in the beginning, and even the instructions also will prepare in the beginning. And we ask questions one by one, and will inform the participant also. We are doing an interview and will record the interview also. Most of the time, the audio is recorded. So in the conversation is a non-guided conversation where they can express their feelings, they can express their experiences related to this particular phenomenon. And then we'll do an analysis. We'll the verbatim, each word by word, we analyze, and we found out the themes in the phenomenon. And then we describe that phenomenon. This is what is done in the phenomenological studies. The phenomenology report in-depth experience of person related to phenomena. An in-depth conversation is a major method for data collection, and we usually collect the data from smaller samples. The criteria is that when the data saturation occurs, we stop the data collection. Example, sometimes with the 3 persons, or sometimes with the 5 subjects, they are giving the same data. We are getting no additional information. The same information we are getting from the 4th and 5th person, then we'll stop by the 5 subjects. So that is a number of subjects will be limited. Or when the data saturation occurs, we stop data collection and then we go for the thematic analysis of the data by the word by word verbatim of the interviewing. This is what is done in phenomenology. The next is the grounded theory. The grounded theory aims to discover the theoretical precepts grounded in the data related to the concerns or problems of person and their actions to solve those problems. Now, this is another most commonly used qualitative study in nursing studies and even by the other discipline students also. And we have done grounded theory studies also in our college by the postgraduate students. So here we derive a theory. We will discover a conceptual, we will develop a conceptual framework and discover the theoretical precepts grounded in the data related to the concern. And the data collection and analysis is somewhat similar to the previous method itself, the phenomenology. Here also we will conduct in-depth interview and observations are used for data collection, and the constant comparison of concepts old and new is done to develop a theory. So this is done in the grounded theory. So up to data collection is very simple in phenomenological studies and the grounded theory studies. But the analysis part, the thematic analysis, normally we use some of the accepted format, and we'll do the analysis according to the format, and each themes will be taken and sub-themes will be developed, and based on the themes and sub-themes we develop a theory in the grounded theory. So this is how we develop the conceptual framework and theory in the grounded theory qualitative research. That is another form of qualitative study. The next one is a historical research. So it involves systematic collection, evaluation, and interpretation of data related to past occurrence. Now take for example the history of nursing in Kerala. How the nursing has developed, nursing practice, nursing education has developed in the Kerala state. So we are planning to do that particular study. So this is a systematic collection, evaluation and interpretation of the data related to the past occurrence. So for that collection, we may collect information by interviewing leaders or by discussing with those persons closely related to these leaders, and we may see some of the photographs during that particular period. Some audio materials will be taken and examined. Important books, diary of those persons, and records and physical evidences will be collected. And even we conduct in-depth interviews also. So we use several forms of data sources for data collection in the historical research. Now another form is the case studies. Case study we are doing in our nursing subjects. We will take a case and we'll do a detailed analysis of the case. The case study as a research is also an extension or of that particular method. It involves intensive investigation of a single entity or small number of entities. For example, we are getting a very rare case that was not described by anyone else. So in that particular case or a similar 2 or 3 cases, we will do an intensive investigation and we explain that. So the in-depth data collection is done over an extended period of time for case study. So that description of case study as a research methodology is done with the framework. So we have a framework which states about how to do a case study, how to describe cases as case study method. So we follow that and we'll do the study according to that. Then next qualitative format is the narrative analysis. This is narrating a story to individuals, analyzing how they make sense of events in their life in the lay activity of a researcher. So this is how the narrative analysis is done. It's basically by telling a story, narrating a story to individuals, and we analyze how they make sense of events in their life. That is done by the researcher. The communication about the inner desires and motives of individuals is done after analysis. So this is something like a projective techniques that is used by a psychologist or by a psychiatrist. There are so many projective techniques you have already learned in psychology classes. This is also a projective type of research methodology. We try to project out the inner feelings, inner desires of the subjects, and we do the analysis about that. We call as a narrative analysis. Then qualitative outcome analysis is intended to find out the theory practice gap. That is a study, qualitative outcome analysis. This will analyze what is the difference between the theory and practice. We are learning a lot of things in the theories, and but whether we are able to practice that. It is not only in nursing, but in all the other fields of science. What is the theory practice gap? So that is what is done in the qualitative outcome analysis studies. Now, another form of qualitative research is the critical theory. It involves critiquing of existing social structure. So this involves not only simple critiquing by saying that everything is not right or everything is wrong, how we can live in this society. It's not simply saying that, but it is an intensive, explorative and explanation about the different aspect, the broad aspect of the social structure. There are strengths are there, weaknesses are there, positive things are there, negative things are there. So we critique the existing social structure that can be based on the political structure, economic structure, and numerous other aspects, multidisciplinary involvement. So multi-branched study is done in the critical theory. So critical theory involves critiquing of an existing social structure. Another form of qualitative study is the feminist research. So it's focused on how gender domination and discrimination shapes women's life. When the name itself indicates that some researchers have done a study mainly on the gender domination or gender discrimination or women empowerment, etc. And they call those type of studies are the feminist studies. And then it has developed as evolved as a branch of qualitative research called feminist research. Still, there can be more type of branches like this can arise in qualitative research. So this is another form of study we can discuss as how gender domination and discrimination shapes women's life. Those we commonly call as feminist research. In participatory action research, this means that this design tries to produce knowledge through close collaboration with groups that are vulnerable to control by the dominant culture. And then in every society, in every part of the world, a dominant culture is there. Example, black and white. The dominant people always tries to control the non-dominant culture. And similarly, there are a lot of culture groups has dissolved from the world, disappeared from the world. This is a occurred. So this study is actually basically based on that particular aspect, participatory action research. And there are entirely different concept is also there about participatory action research in community studies. That is another entirely different aspect. That is a quantitative study, also called as a participatory action research, where we collect data from many people with their involvement. For example, we want to collect income status of a group of family. If you go and ask the family what is your income, they will not reveal at all. Sometimes they may say that their income is 500 rupees per day. They will say that my income is only 25 rupees. So sometimes, at least some people, they say that even though they are getting 500, they may say 5,000 per day. So we will not get the actual figure most of the time. So for that, what we can do is call all 10 family, head of the families to a common place and ask what is your family income. Person say that my income is only 25 per day instead of 500. The neighbor will say that no, that is wrong. His income is 500. You will get the correct figure in the participatory action research in community studies. So that is entirely different. That is a quantitative study. But in qualitative study, participatory action research means tries to produce knowledge through close collaboration with groups that are vulnerable to control by dominant culture. Now, next one is the descriptive qualitative studies. So I have mentioned that in the initial slide itself is a group of unclassified or non-documented qualitative studies. There are so many studies, type of studies are there like a feminist research. So all those unclassified qualitative designs and non-documented qualitative designs and those qualitative design that will emerge in the future also is grouped under descriptive qualitative studies. So these are the different forms of qualitative studies. The brief description of that of the qualitative research. Now the advantage of qualitative studies. The in-depth study of a phenomenon is done. Now quantitative studies most of the time deals with the numbers, quantity, and it's a superficial form of study. We just want to confirm about the cause and effect relationship. or the relationship between the variables, or for a descriptive purpose. They will not go into the emotions. They will not go into any other form of psychological state or social phenomena. And they will not, the quantitative study will not go into the depth of that. But qualitative studies are going into the depth of a phenomena and will explore, excavate all those phenomena. So this is an in-depth study of phenomena. Second advantage is that the critical analysis and broad description is given about that particular phenomena in qualitative studies. The third advantage is that holistic and a complete aspect of phenomena is studied. It is the holism. The full aspect is studied. Complete aspect of the phenomena is studied. For example, the pain by the postoperative patient means we'll discuss, we'll explore the complete aspect in 360-degree. Whole aspect will be explored related to that particular pain, related to how they feel, how they experience. All those things will be evaded, explained. Now the fourth advantage is that the individual or subject is focused. So that is a major focus. We will collect the data only about the emotions, only about the psychological state of the particular individual. It is not deviated out. We collect data only from few subjects, but the focus is the subject, so individual or subject focus, and it is economical also. There is no need for prepare any questionnaires, any equipments, not much expenses similar to that. So it is economical. So these are the advantages of qualitative research. At the same time, it has few disadvantages also. The disadvantages of the qualitative study include quality of data cannot be checked always. For example, a person in intense emotion, that may not be their emotion always. For example, at the time of data collection, they will be in severe anger, but normally they are not like that. And some of the informations, if they are not telling correctly or giving a false information, cannot check. The quality of data cannot be checked always, but most of the time can be counter-checked. The skill of researcher is highly critical in this design. The ability to collect data, ability to get complete data, and the word by word analysis and finding themes out of that. That is a very skillful work. If you are lacking any of these skills, it is very difficult to conduct a qualitative study, because we cannot emerge the correct theme out of the verbatim. So the extraction and finding or discovering the correct theme and sub-themes to the fullest extent from the verbatim is the critical aspect and the skill of the researcher. The next disadvantage is that objectivity cannot be maintained in few designs because of the intimacy between the subject and researcher. And that is another problem that can happen. Because of the personal in-depth interview and emotional intimacy between the subject and researcher, sometimes the objectivity cannot be maintained in few designs. And there are so many other things also can happen because of this intimacy, because once one of our students who did a study on dialysis patients, because of the intimacy and emotional attachment and all, offered that we will give a kidney to that particular patient if that patient is going for a kidney surgery, kidney transplant. So these type of problems can occur. The emotional problems can occur in qualitative studies. Then quantification is not at all possible in qualitative studies. If you want to quantify, it is not possible because this is an entirely different approach in research. Then interpretation of finding is difficult. And we are mainly using the thematic analysis. Only the themes are analyzed, and interpretation may become difficult sometimes in some situations for some researchers. So these are the advantages and disadvantages. You can prepare this for as a sometimes you will get an essay question, then you can list down with the example you can write. Sometimes you will get only a short note like list down the qualitative designs. Sometimes a short note can be asked about one of the mainly the phenomenology or grounded theory can be asked as a short note also. So these are all about the qualitative research. In the next class, we will discuss about the mixed research. That is a third big category. The first category is a quantitative research that we have discussed in many classes. And the second category is a qualitative research that we have discussed today. And third category is the mixed form of research that we will discuss in the next